Three doctors dismissed Sarah's crushing chest pain as mere anxiety before a silent heart attack nearly killed her at 32. When your health symptoms are written off as stress, you aren't just losing time, you are losing your life. I am revealing the exact three-step documentation framework that forces medical professionals to stop labeling you as anxious and start investigating the root cause of your pain today. Time equals sine 100 ms, and the last method? It is a technique used by patient advocates to force a shift in the way a doctor perceives your symptoms, and it works better than the other two combined. So sit back, grab a glass of water, and let's get to it. Why does this happen? It is not just one bad experience. A study published in the Journal of Women's Health found that women wait, on average, 2.5 years longer than men to receive a diagnosis for the same chronic conditions. That is nearly 1,000 days of living in pain, wondering if you are imagining things or if the fatigue is just part of being an adult. The issue often starts with a medical bias that labels women's pain as emotional rather than physical. Let us look at the first step to reclaiming your voice: data visualization. The easy win is to stop describing your symptoms with adjectives and start describing them with numbers. Most people walk into an office and say, "I have been feeling so tired lately." That is subjective. A doctor is trained to categorize subjective complaints as low priority. Instead, keep a detailed tracker for 2 weeks before your appointment. If you suspect a hormonal imbalance or an autoimmune flare-up, record the specific timing, duration, and intensity on a scale of 1 to 10. I remember a friend who kept a log of her joint swelling every single morning. When she handed the paper to her doctor, the conversation changed instantly. He did not see a stressed patient anymore. He saw a data point. Data is the universal language of medicine. Once you provide evidence, it becomes much harder for them to deflect. Now, let's move to the second step: the power of the open-ended pivot. This is the level up. Many of us try to suggest diagnoses to our doctors because we have spent hours on the internet. While being informed is good, telling a doctor what you think you have often triggers a defensive reflex. They might think you are suffering from hypochondria or that you're just shopping for a specific result. The better move is to lead them to the conclusion yourself. Ask them, what other possibilities have we ruled out? Or what testing would be required to rule out condition X? This phrasing puts the burden of proof back on them while making them feel like a collaborator in your investigation. A study in the Mayo Clinic proceedings showed that physicians who feel their expertise is respected are significantly more likely to engage in collaborative diagnostic reasoning. By asking for the process of elimination, you are forcing them to think systematically about your case rather than impulsively dismissing it. If you are finding this helpful, hit subscribe. I drop videos like this every week to help you navigate systems that were not built for you. It helps me keep making these, and it keeps you in the loop for the next breakdown. Okay, so those first two methods will get you a seat at the table. But you want to know the one that I've been saving? Here it is. This is the professional advocacy secret known as the formal medical request for refusal documentation. If you reach a point where a doctor refuses a test or a referral that you are asking for, you look them in the eye and say this exact phrase: "I would like you to document in my chart that I requested this test and that you are declining to perform it, along with your clinical reason for doing so." Think about that for a second. This changes everything. Doctors operate in a world of liability. When they know their clinical reasoning for a refusal is being recorded in your permanent medical file, their behavior changes instantly. Often, the refusal disappears and the test request is suddenly honored. It is not about being combative, it is about accountability. A peer-reviewed study in the journal Healthcare found that when patients used explicit language regarding medical documentation, physician compliance with evidence-based diagnostic procedures increased by over 30%. It is the ultimate insurance policy for your health. It signals that you are not a passive recipient of care, but an active participant who is keeping records. You are essentially telling them that you are ready to be your own primary investigator. That one shift alone could save you more than the first two methods combined. Once you see it this way, you can't unsee it. You no longer go into the office asking for permission. You go in as a partner in a professional transaction. This is the difference between hoping for a diagnosis and taking control of the process that leads to one. Remember, your health is a multi-year project, and nobody knows your body like you do. If the first doctor is not listening, the documentation request is the bridge to finding someone who will. Because even if they refuse, You now have a record that you can take to the next specialist. It shows you are serious. It shows you are informed. So there you go. 3 real ways to advocate for your own health, and the last one alone could change your entire medical journey. You have the data logging for clarity, the strategic inquiry to build collaboration, and the documentation request to ensure accountability. It is a powerful trifecta that puts you back in the driver's seat. If you got value from this, share it with someone who is currently struggling to be heard by their healthcare provider. Hit that subscribe button so you don't miss the next deep dive into how to hack your own lifestyle and medical experiences. Next week, I am doing a breakdown on how to navigate the complex world of insurance billing errors, which is another area where a little bit of knowledge saves thousands of dollars. Keep fighting for your answers. Your persistence is not a character flaw, it is a necessity for your well being. I will see you in the next one.